Dr. Javier, thank you for sitting with us and taking the time from your busy day. You have 15 years of experience as a cardiovascular specialist, a lot of work with catheter-based therapy. From your perspective, what would be the value added for a cardiovascular specialist and the value it adds to the field of veins?
Veins are being treated now with catheter-based intervention. The skill that cardiology brings, it's unmeasurable. We've been working with catheter-based intervention since Dr. Grunsick came out with the first angioplasty. That field of catheter-based intervention has just revolutionized cardiovascular, and the vein is not any different. So the skills that we bring while working with coronary, which is a very difficult and that needs a lot of skills with catheters, that I think is going to be a value to the vein world. As you know, now surgeons are also getting involved with catheter-based intervention. A lot of therapies that were used to be done surgically are now being done with catheter-based intervention. There's a big difference between cardiologists and surgeons. The way we approach the conditions in a clinical way. Of course, many of them you have to address them as a procedural way. But the fact that we can provide the patient with not only the procedure, but with the lifestyle modification. I mean, right now, there's a lot of lack of education to the patients. You know, we tell them, well, go and exercise, go and lose weight, but we don't tell them how to exercise, and we don't tell them how to lose weight. So we have all these patients that we're telling them what to do, but we're not guiding them how to do it to achieve that. That part of the clinical aspect of the condition is, I think, where the cardiologists really help a lot. That we can sit and guide the patient to a weight program, also to an exercise program, guide them to what are the right kind of exercise, and then follow them clinically. So I think that clinical aspect that cardiology brings to vein is very important now, and that's why I got so interested in it.
Now, we know the American market is growing, but when speaking about Latin America, is this a market that's receiving the right type of information?
Latin America right now, it's probably like United States was 10 years ago with vein. They have not really discovered the newer available therapy for veins that we have these days. And that has to do for many reasons. One is how expensive the equipment is to treat vein disease, and also the lack of awareness. There's so much vein disease in Latin America, and so much good that we need to do, that we do need to increase awareness in that area. I'm actually at this point trying to contact the Society of Latin America Interventional Cardiologists and trying to start increasing their awareness. We're training doctors in the Dominican Republic, and right now we want to start pulling doctors from Central America and South America. We have contacted a few doctors from Mexico who showed interest in the technique. I think that this program and that we have in the Dominican Republic is going to expand, hopefully in the future, that we can also provide education for the doctors in Latin America.
What does a center of excellence mean to you?
A crossroad of quality and innovation. It's a center where the newest forms of therapy and diagnosis are available, and also where the personnel has the highest skills available. So I would call it as a crossroad between innovation and preparation. Let's
talk about your involvement abroad. You also do the Master's Practicum in the Dominican Republic. Talk to us a little bit about that.
When I got into veins many years ago, I hooked up with Jose, Dr. Almeida, and we were both discussing the importance of getting awareness for vein condition and the lack of places where you can train. Not many training programs. We're emphasizing vein program either for cardiologists or for surgeons. Talking about this and the need to expand the knowledge of vein care, we traveled together to the Dominican Republic and found a significant amount of disease there, and started like that. We get together a group of physicians who want to learn the technique and want to learn about vein disease, and then we go to the Dominican Republic and we do multiple cases there. So not only we're educating a lot of physicians on the newest treatment for vein, but we're also helping significantly a lot of patients that are in need and cannot afford to have these procedures done. And that's Master Practicum has taken a life of its own. Actually, we're on our 4th year now, very successful.
Why would the consumer want to learn about these new treatments, and why seek someone like yourself?
Coronary disease was the same. We used to do bypass for everybody until the angioplasty and stents came out. And I thought, well, gee, if I can put a stent in a coronary, putting a catheter in a vein is a piece of cake. I mean, a heart is a beating organ, and a vein is just sitting there, and it's a lot less riskier. So it caught my interest, and also caught my interest that it was done in the office. Anything that you can do in the office that is so beneficial for the patient, because it's a more relaxed environment and more tranquility, and not having to expose them to all these anxiety that a hospital brings. So when I saw that technique being applied and the percutaneous, that's how it caught my attention. And then when I started discovering all the conditions that accompany vein disorder, I just looked at my patients, and I started seeing that 3-4 patients a day were having significant venous problems, and we were not really addressing them. So that's how I actually got into it. The importance of it is that, like me, there's a lot of cardiovascular specialists out there that do not know how to diagnose it, or how to treat it, or who to send them to. And there's a lot of individuals doing vein that are not really vein specialists, that do not know the entire spectrum of the vein condition. So when the importance of going to someone who has the knowledge of not only the diagnostic criteria, the therapeutic criteria, but all that's involved with the vein condition, it's very good for the patient.
That's actually what we're trying to provide, that right kind of information with Best Vein Care, where the consumer can weed out the information and see who is who. And that's what part of our verification process is, which makes sense. Now, to ask somebody like you, in the state of the economy and the conversation that we're in with healthcare, what does quality care mean to you?
The most important thing for any practice would be quality of care. I think that it is important that either we have some way of measuring quality of care and of knowing, the patients and the public knowing, which are those individuals that are providing the best quality of care. You see a lot of internet programs and a lot of companies out there that are trying to do that, but there's very few companies that are really trying to identify those individuals that have the complete package. I think that quality of care is the most important thing, and also knowing who are the ones that are providing that quality of care.
You're also at the faculty at the International Vein Conference in Miami.
Dr. Almeida has done a great job in bringing the top vein specialists in the world to update everyone, faculty and attendants, on what are the newest forms of therapies out there and the new developments in vein. To me, vein, I see it like I saw coronaries 15 years ago when the stents came out. There's so much coming out on veins, and it's incredible how fast it's going and it's evolving.
How do you feel the industry, where it's going, where it was, and where do you think it's going here in the short term?
Before, vein was seen more as an aesthetic condition, and now as a cardiologist, I can see all the clinical aspects of veins. So there's so much industry getting involved in it that tells you the importance that veins are taking place today. The fact that there's more awareness, the diagnostic equipment, I mean, there's tremendous amount of ultrasound devices that it makes it so easy, and it makes it so accurate to do the diagnosis.
Yeah, incredibly beneficial for the patients. Yeah.
We're understanding more of the physiology of the veins. It's helping us guide our therapy more to the proper form of therapy, and identifying what are the things that play a role in venous disease. So I see the industry with a tremendous growth in the next 10 years.
Yeah, very beneficial for patients. The whole minimally invasive movement could only get better since technology is relatively new.
That's correct. I mean, there's nothing better than going to an office under local anesthetic and taking care of your vein problem. And instead of being admitted to a hospital, being exposed to all the anxiety that it's involved with a hospital, and you walk out of the office in an hour and you're back to doing your daily activity. Nothing beats that, and the goal of medicine is doing that, trying to the least traumatic procedure on the patient to solve their problem.
Dr. Javier, thank you so much for sitting with us.
Thanks very much.